All right, so I think we'll go ahead and get started. I just have, welcome everybody. I have kind of a shortened presentation today. As many of you all know, there was a ruling last week regarding short-term medical and duration. So we've actually been expecting this for some time. Our friends at Pivot were aware of this pending rules, and so we'll see what happens. It could certainly change again. With the election, we never know, but we'll just, we just pivot as we need to with the products. But Pivot still has a place, and we'll just talk about that in just a second. So again, welcome everybody. My name is Lynn Tim, and I'm VP of Sales and in charge of the Pivot Health program. All right, so let's just talk about these final rules that were released last week. So Health and Human Services is amending the federal definition of short-term limited duration insurance to limit the length of the initial contract term to no more than 3 months and the maximum coverage period to no more than 4 months, taking into account any renewals or extensions. For policies or contracts of short-term medical sold or issued on or after September 1st, the maximum term and duration amendments to the definition of short-term, the final rules apply to coverage periods beginning on or after September 1st. So none of these changes go into effect until after September 1. So, we've certainly got some time to continue just as we have been. And for policies and certificates of short-term sold or issued before September 1st. So anything you have on the books or that you sell between now and September 1st, they can still keep their coverage. They're going to be grandfathered in. So if you've got clients that are in a state with up to three duration periods, then that client will continue with their coverage as is. So no changes to anything that is currently on the books. So one thing I might suggest is, as Andy posted in our Facebook group, this could be a fire sale. Pivot feels that they have a place in this market. Some of the larger carriers, United Healthcare and Allstate, who have short-term plans, have kind of, they're not really pushing those products, and they haven't been for some time. So there's always going to be a need for short-term. Short-term has been around for a long time, and it's always been used as kind of a stopgap in between someone coming off a group plan. I mean, you guys know all the reasons why someone might need coverage for a few months, but what's nice is it may be one of very few players in this market after September 1st. So there's still, short-term medical is not going away. It's just going back to more of what it was, prior to, the last 4 years when it changed and was allowed to have longer durations. Or actually, it's been longer than that. Don't have the exact date. So, some of the things that we know is, Pivot, all the pricing is still very affordable. You can still lock in up to 3 years with those companion plans. I don't believe the quantum plans have the locked in pricing, but it might depend on the state. So, but everything else, the choice, the economy, and those Pivot companion products, you can lock in the rates for up to the 36 months. So if you do have clients that want this product, definitely lock them in as long as possible. Remember, they can always cancel after 1 month. So, they're not, basically they can buy into it and hold that rate. So big selling opportunity there. As well as, after all of these changes go into effect in September, then we'll see, if Pivot is one of the only um, plans that is doing this, there's going to be still a huge market for people that need coverage for 3 to 4 months. So, keep all those things in mind. So this is also another good reason to stack your plans. I went over this last week, but just remember if let's say, you might want to change the level of coverage. So if you're selling this with indemnity, then you can sell a higher level of indemnity. And then if they, if once their short term drops off, then they'll still have a high level of coverage with indemnity, critical illness, and so forth. And you can certainly use indemnity by itself as kind of the base of the plan and add on some extra critical illness, out of pocket protector, accident plan, etc. So, this is just a sample that I gave last week. And if you want to see last week's where I went into a lot more detail about stacking, we can certainly send that recording to you. But just one thing to keep in mind, as you're selling Pivot now, stacking can be even more important. So if their short-term drops off, they're still going to have some coverage. Does anybody have any questions about any of this so far? Okay. All right. So lastly, I just wanted to talk a little bit about our Facebook group. So if you're not a member of our Facebook group, please join. You can, my email is there at the top, ltim@na-insurance.com. If you will send me an email on anything you need regarding pivots. So, I have the stacking template. I have uh, the call sheet with just some useful information. And if you need a script for any of these live transfers you're getting, I do have a script that you can use, and just send me an email. I'll send that to you, as well as some of the selling points. We also have a library of Pivot um, webinars, going into a deeper dive into the products. So any of that, for any of you that are new and haven't seen all of these webinars, just let me know what you need, and I'll get that to you. Next week we're going to have Robin and Letty, who are our representatives with Pivot Health. They've worked there for a long time. They're going to do the call next week with me and do a deeper dive into these changes. I mean, I just went over, the basics. I mean, they are what they are. And those of us that have been in this business for, a while, as we know, we're affected by legislative things. So it's not unusual that products, change and the rules change regarding selling them. So, don't be alarmed. As Andy said, this is really an opportunity. And there are people out there that love this product, and there are states that don't have a lot of options. And this is really a good product for them. So keep in mind, think about any of you that are in states that have very limited choices and do offer the pivot short term, that this is an opportunity for those people to get in, as long as the duration allows on that specific state. The other thing I just wanted to mention is our agent conference. I know I talk about this every week, but it's going to be really fun. We have a private tour of backs, in the back offices and the training rooms and so forth of the Cowboys training facility, and I've done it. It's really, really cool. And you never know what Cowboys are going to be walking around uh, in July, and what's going to be going on there. And then at the Cowboys Club, we also have a There's a private room there that overlooks the facilities, and it's very, very swanky. And the 199 ticket gives you all the VIP access. However, if any of you are interested and you haven't bought your ticket yet, let me know. And I can help you with we'll help cover the cost for you if you come. So we'll give you kind of a rebate on your ticket. And we just want you to come and meet all of us in person and meet our vendors and all of us. And there's going to be lots of great sessions and breakout sessions and lots of time to network. So if you haven't been to it before, it's really worth attending. So let me know, and I'm happy to help you cover the cost of the ticket. That is really all I had for today. If anybody needs me, just send me an email and let me know what I can do to help. And if you're new to selling Pivot, please try to be on the call next Monday when we have Letty and Robin on, because they're going to be going into much more detail, as well as going over some new products that they will have on the Pivot platform. So, Pivot is actually a marketing company, and their products are underwritten by insurance companies, but they are, so they have other products as well that you can sell with Pivot. So anyway, anybody have any questions? Okay. All right. Well, thank you everybody for coming, and I hope you have a great week. And please send me an email, ltim@na-insurance.com, and I will send you any of this information that you need. Have a great week. Thanks. Bye-bye.